Cancer is the third leading cause of deaths nationwide, only next to heart and vascular system diseases. Now, the World Health Organization says colorectal cancer is the fourth leading cause of cancer-related deaths globally. As we observe colorectal cancer awareness this March, one institute is going out of their way to ensure that people are aware how early screening of the diseases can actually save lives. Joining us today is Dr. Jun Ruiz. He is the colorectal cancer screening lead of the Medical City's Augusto P. Sarmiento Cancer Institute. Good morning and welcome to New Day, Dr. Jun.
Good morning, Dr. Freddie. Good morning to all the hosts. And good morning to the viewers out there.
Now, Doc Jun, colorectal cancer awareness is what we're going to talk about. But before we talk about the programs and all of that, let's give a brief lesson to our viewers on ano ba talaga ang colon natin? What is colorectal? Or what is the colon for?
So the colon is actually storage of our feces, yung mga dumi natin. And before it actually gets excreted out sa anus natin. So, dun nakatago yung dumi natin before we excrete. So, it's like a storage organ of the digestive system.
Okay, so it's part of the digestive system. Ngayon, ang ayaw natin syempre dito is magkaroon ito ng cancer. A lot of our viewers here, especially, ang gusto nilang malaman, ano ba itong symptoms na ito, doctor? What are the symptoms para maagapan natin? But colon cancer is a bit different there, Doc Jun.
That's correct. Kasi colon cancer, when it presents, usually it's already in the later stage. So you could have colon cancer early on without symptoms. So we don't actually use symptoms alone to screen for colon cancer kasi colon cancer is a screenable cancer. That means we can prevent, we can detect the cancer in its early stage when the treatment is most effective.
So kailangan maaga, no? Pag wala pang sintomas, wala pang symptoms, that's the best time where you can actually catch colon cancer and have good treatment for that. Now, let's talk about some of the things that our viewers can grasp on, and that is the risk factors for colon cancer. Talk about that really quick, Dr.
Okay, so risk factors could be classified as modifiable or non-modifiable. Ibig sabihin, nababago o hindi nababago. So the non-modifiable risk factors are like age. You cannot change your age, family history, personal history of colon cancer, and the non-modifiable, ito yung mga lifestyle habits natin. Smoking, alcohol, diet. If you eat a lot of processed food and mga charred food,
barbecue,
it increases your risk for colon cancer. But if you eat fiber, fruits and vegetables, it lowers the risk of your colon cancer. Obesity is also a risk factor, so we need to exercise and avoid sedentary lifestyle.
Okay, so that's good to know. Now let's talk about the National Integrated Cancer Control Act, which is actually aimed para ma-improve ang cancer treatment dito sa Pilipinas. Talk a little bit more about that.
Yes, actually this was a law that was passed in 2019 under the previous administration, and it was aimed basically for two things. Number one, improve into high quality cancer service for our patients and provide equity and financial capability of the Filipino cancer patient. As you know, having cancer can be a financial catastrophe for most patients.
Okay, so all of this is aimed for the Filipinos para mas maganda talaga ang cancer care
That's
for
right,
Filipinos.
that's right.
Now, you'll also be having a forum on this March because March is Colorectal Cancer Awareness Month. Talk more about that.
So that is actually our slogan since March is Colorectal Cancer Awareness Month. So our slogan was March Against Colon Cancer. And this is towards a universal cancer care for our patients beyond the pandemic. It will be on March 3, this coming Friday at 9:30 on the Facebook Live of the Medical City Facebook page.
Okay, so all the information that our viewers can get regarding colon cancer, how important screening is, how dapat by age 50, meron na tayong at least screening process when it comes to colon cancer. So all of that, they'll be able to log on for free. Is this for free?
Yes, it is for free. So we would like to invite everyone to watch our webinar on March 3, Friday at 9:30, Dr. Freddie.
Excellent. Thank you so much, Dr. Jun, for joining us. You are the cancer screening lead of the Medical City's Augusto P. Sarmiento Cancer Institute. Thank you so much for joining us here on New Day.
Thank you very much.